It's been a pleasure to have been invited to give a talk in the radiotherapy session here at the Oncology Forum, and it's a very exciting time in terms of the proton beam therapy initiative. We're about to start treating at the Christie. That should be in the autumn. We'll be treating our first patients, and that's a really exciting time. And proton beam therapy is the biggest, most challenging radiotherapy project that we've done, well, for a century. Actually, it's bigger than any of the other recent developments, partly because there are things about it that we don't quite know the details of. So there's a lot of work to do in understanding better the uncertainties associated with it. Well, one of the big uncertainties is who to treat with protons. And although we think there's a major advantage for children because their normal tissues will get less exposure to radiation, so that there will be less growth impairment and a lower risk of second malignancy, we don't quite know what advantages there will be for adults, and therefore we don't quite know exactly which patients should and shouldn't be treated. So one of the really big challenges is about understanding that, and that means we have to do clinical trials, and we need a combination. We need a mixture of some patients in randomized clinical trials, which of course reduces the bias associated with selecting patients. We need some patients in cohort studies, more like a phase 2 non-randomized study. And then we have a third group of patients, that's all the rest that we treat, who need to be in proper outcome tracking studies, which we need to consider as research, because those people represent an incredibly important group of patients within whom we will find out more about the pros and cons of proton beam therapy. And those people, in fact all of the people in all of the cohorts I've mentioned, need to be followed up for at least 10 years, but probably for life. So another of the challenges associated with this is how to persuade funders to actually adopt a proper, safe approach to understanding this new radiotherapy modality.